Hi everybody, it's Dr. Dan here at the Balancing Center to talk to you a little bit about how nutrition relates to the care here at the Balancing Center. And like everything else that we look at here, it's not a one-size-fits-all, but there is a nature of balance that we have to be looking for. Now, there are people that are protein types, there are people that are carb types, and there are people that are mixed types. So protein types do really well on high protein and green vegetables. Carb types are the ones that go really well for grains and beans and also need green vegetables. Mixed types can eat a lot of the different things, but sometimes it's good to eat your proteins with greens and your carbs with greens and not necessarily, put them all together. So we can help you sort that out a little bit, but I think if you just look at your own responses to food in your life, you can kind of get a sense of what really works and what doesn't work. But as we get your body back into alignment and we take the pressure off of that upper back where the nerves that run digestion, detoxification, elimination, urination, recreation, and procreation, when those upper back nerves get in control, it really starts to shut down the body's natural processes of digestion, detoxification, elimination, urination, recreation, and procreation. Now we need to have a balance of that. It's called the sympathetic nervous system and the parasympathetic nervous system, and we need them both. One says rev up, there's an emergency, get ready to run. One says rest, digest, eliminate, urinate, recreate, and procreate. So there's the practices that we teach, the foundational movement practices, where the first few are really designed to take you out of fight or flight, remind your body that you're in rest, digest, and take care of the basic needs again. Having your neck out of alignment causes your body to be mostly in fight or flight too much of the time. So we want to make sure that this upper cervical correction has your body responding and adapting rather than reacting and defending. So it really depends sometimes on how you're designed. Sometimes it's genetic, sometimes it's just what your body's designed to do. And most people know what they function well on. So a lot of people can eat high protein with greens. Other people can eat grains and beans and greens and sea vegetables and be just really, really energized and fine. We do recommend a product called Ease that comes from the Arenda company that has prebiotics, probiotics, acid balancers, systemic enzymes, digestive enzymes, so that the whole digestive process from stem to stern is amplified, optimized, and that you have the resources you need to digest whatever food you are eating. Because that's really the big deal, is are you getting the nutrition out of the food you're eating? Are you digesting and assimilating properly? And in the nervous system that has two different stages, one is sympathetic, which says rev up, we're ready to run and fight. The other is the parasympathetic that says rest, digest, and do all the other urination, recreation, and procreation. So in the body, having your head on straight so that the system is engaged, having that engagement from the body to the ground that gives you an experience of connection, leverage, and resource. Having your nerve system freed up enough from the mind, the emotions, the imaginations, the traumas, the dramas, the histories and mysteries that we do with the BEST and the neuroemotional work, with the muscle testing, frees your body up to be present, to digest, eliminate, urinate, recreate, procreate, use the foods that you need. And if you can eat clean foods, fruits, vegetables, should be organic if possible. Meats, again, organic if possible. And for those people that know that they run better on grains and beans and nuts and seeds, and those people that know they run better on proteins and green vegetables, that's just something that you can figure out for yourself, or we can help look into it a little bit when you're here. So if your body's in a state of emergency from a trauma, drama, history, mystery, using the muscle testing, we're able to find the body a solution to the situation so that we can neutralize that. If your body's out of alignment because your neck's off center and trying to get back to the vertical, that's going to put you into a subtle emergency that can also interfere with your normal digestion, detoxification, elimination, urination, recreation, and procreation. So getting your body balanced, getting the leverage and the resource from the foundational movement practices, also using the foundational movement practices to interrupt the pattern. So when we lay on your back and you push into your feet and you lift your back belly and lift your pelvis off the table or the floor and relax everything, it really reminds your body that the emergency of the day, the emergency of standing, the emergency of what's been on your mind can take a break. And as that happens, your sympathetic nervous system releases, your parasympathetic nervous system, which is the rest and digest system, kicks in. So leverage, connection, and resource creates agency, adaptability, and engagement. And the foods we eat can digest better, and we can make better choices because we'll be knowing what's really working for us. So have a good month.